Hi, so I'd like to talk about a few different disorders, uh, mainly ones that um, are categorized, and the other um, lecture was on schizophrenia. This one is on dissociative disorders. I do not have notes online for you for dissociative disorders. However, I will go over them and talk about them a little bit. It is a disorder, or they are disorders, that are extremely rare. Very few therapists encounter clients suffering from these disorders. Um, and very few therapists have the training to deal with these disorders. When I was teaching at the Citadel in Charleston, South Carolina, my supervisor, George Williams, uh, was a specialist in dissociative disorders, and clients would come from all over the Southeast uh, to see him. And he eventually confided in me that um, he ended that practice because it was extremely stressful for him. It is a difficult diagnosis with which to deal and treat. And um, in, in many cases, um, I would say the majority of cases, there was some type of abuse. Um, Now, I'm trained to deal with various aspects of abuse, um, but I do not have the training to deal with the result of multiple personalities. Um, so, and this includes all kinds of abuse: emotional abuse, physical abuse, sexual abuse, and most likely a combination of all of those. Um, and uh, in order to deal with those horrors and that trauma, people often repress the traumatic memory. Now, that is the most common aspect of that, but in rare cases, a separate identity evolves uh, in order to compartmentalize that trauma. And, uh, and many individuals have multiple uh, personalities. Now, this used to be called multiple personality disorder. Now it is called dissociative disorder. The video that I put up on Films on Demand still calls it multiple personality disorder. So I just want to avoid any confusion with that. So let's look at the DSM for dissociative disorders. We have dissociative identity disorder, dissociative amnesia, depersonalization and derealization disorder, and other. Uh, so, and this is just what I've learned and been told over the years. Um, in many cases, when people experience these types of trauma, um, dissociative amnesia is often a little more common than dissociative identity. So let's look at dissociative amnesia first. And remember, all of these dissociative disorders are different than schizophrenia. In schizophrenia, you don't develop a separate personality. One personality becomes disturbed because of schizophrenia. So dissociative amnesia, an inability to recall important autobiographical information, usually of a traumatic or stressful nature, that is inconsistent with ordinary forgetting. Dissociative amnesia most often consists of localized or selective amnesia for a specific event or events, or generalized amnesia for identity and life history. Many times a client will describe this as losing time. There's a missing period of time. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributable to physiological effects of a substance like alcohol or other drug abuse, or a medication, or a neurological or other medical condition. One of the first things I do if a client is missing a period of time is I refer them to a specialist, a physician, a medical doctor. There may be a medical reason for this, anything from a tumor to some type of brain damage. So it's important to have a complete physical examination when this occurs. And there are various subcategories of dissociative. Now, so let's look at dissociative identity disorder. There's so many movies and television shows that include this type of disorder. It makes individuals feel that this is a common disorder, whereas it is an extremely rare disorder. I have never encountered a client with this disorder, and if I did, I would refer them to a specialist and a medical doctor. Okay, so dissociative identity disorder. A disruption of identity characterized by two or more distinct personality states. So that's the unique aspect of this, which may be described in some cultures as an experience of possession. Now, my own theory is that the concept of like spiritual or demonic possession is or might be a result of dissociative identity disorder. Remember when we were talking about the history and we talked about things like trephination and things like that? There may be a historical link between these concepts of possession and multiple personalities. We're not sure because this was unable to be documented at the time. All right, so the second thing, and second part of A, the disruption in identity involves marked discontinuity in sense of self and sense of agency, accompanied by related alterations in affect, behavior, consciousness, memory, perception, cognition, and/or sensory motor functioning. These signs and symptoms may be observed by others or reported by the individual. Now, that's the main thing in a differential diagnosis. B, recurrent gaps in the recall of everyday events, important personal information, and/or traumatic events inconsistent with ordinary forgetting. That's close to the amnesia one, but we add that other personality aspect. And you know, I think that sometimes one personality is aware of the other personalities. In other cases, they are not aware of the other personalities. C, the symptoms cause clinically significant distress or impairment, social, occupational, or other areas. So it's pretty much what you think. It's not a difficult diagnosis to make, but there are so many things to rule out. especially drugs, medication, physical aspects, things like that. If we do have individuals who are experiencing either one of these diagnoses, one of the things I think is very important is to make sure that they are safe. Make sure that any abuse is no longer a part of their life, and then we can move forward from there. But the first thing is to make sure that they are safe and that others are safe. That's the most important thing. So when I talk to my friend George about how he treats this, and I am not an expert at this, but the first thing he said is to build trust and an experience of safety with another individual, most often the therapist. They do not, the clients find it difficult to allow themselves to become vulnerable, hence the creation of these alternate personalities. And that's because usually of some type of trauma. So the first step, trusting professional and safe relationship. The second step is to identify the personalities and to begin to give the individual a sense of control in their own minds. The third thing is a long process of reintegration, and if they are able to remember any type of trauma, to process that trauma. That is a long process. I would also say that there should be some cautions. Many times, individuals think that hypnosis might help. And there was a period in time where they thought hypnosis could recover lost memories. And what they found as a result of that is that it is often creating false memories. And that is because human beings are highly suggestible. If we ask a leading question, like, have you experienced trauma? That's a leading question, and it brings up a specific. Humans have very creative minds, and we also want to please others, so we want to be able to answer things in a positive, even if it is a negative question. So hypnosis is unreliable in repressed memories, and it is often creating false memories. So that's just a caution. But if you were to experience a client with either of these, you'll want to get some supervision and referrals. All right.